Okay, welcome back to Business Owners Speak. Today, I'm really happy to have with us Dahlia Attia-King with Panacea. Dahlia, how are you today?
I'm great. I'm recovering from a cold, but other than that, I'm wonderful. Thanks so much for asking.
My pleasure. Great to have you and looking forward to hearing about your journey. So, if you could start out by telling us a little bit about you and your business.
Yeah, sure. So, gosh, it's really hard to pick a spot to begin because this journey has felt like such a whirlwind and an up and down experience. But really, to be honest with you, I never in a million years thought I would be an entrepreneur. It was the absolute last thing on my mind. I wanted to become a doctor like my father and my grandfather. And I was pre med at the University of Miami. I was literally applying to medical schools when I got the opportunity to work for a small group of genetic laboratories. And I thought it was a great opportunity. Genetics is a very important piece of medicine, clearly, and of course, of my education. And so I took the opportunity, and little did I know that that opportunity would virtually change my career and life trajectory. Um, Ultimately, what ended up happening is I was exposed to the realities of healthcare as it stands today, and the business side of healthcare, which I knew nothing about. Right, I knew the medical side, the science side of things. And what I learned at these laboratories is that there is this incredible life changing, life saving technology called next gen sequencing. And next gen sequencing allows for the reading of a genome. So it literally reads the genes of an animal, um, mainly humans, right? That's typically what this laboratory was for. But despite the existence of this world changing technology, um, very few people could access this technology. Very few people could get their hands on this test. And it wasn't for any other reason except insurance companies didn't do a great job of widely covering this test for people. So very few people would receive coverage and funding for it from their insurer. And because of that, doctors were not ordering this type of testing for people. They knew the hell that patients would face with their insurers if they were to order this type of test, even if it could change or save their lives. And when I learned that, I was just blown away. And I said to myself, this cannot possibly happen in healthcare because genetics is the future of healthcare. Precision medicine, personalized care, all centers around genetics. And if people can't get the basics, right, they can't even get a simple genetic test to tell them where their inherited disease risks might be and change their lives or save their lives, then we're in a really ugly spot. And so I kind of made the decision at that point to take a very different route for my career. And I put a pin in med school and said, med school is going to be around, it's not going anywhere, but I have to chase this lead and I have to see if this is a problem that I can solve, or is this something that I can make better? Because if I can really change this, if I can make this area of healthcare better by improving access to genetic testing, I might be able to leave a bigger footprint on this world than I ever thought. And so, long story short, that's essentially how I am sitting in front of you here today, because I decided to chase this little interesting lead that I came across about a decade ago.
About a decade ago. Okay, that was my next question. So,
Yeah.
so at the birth of the business till now, well, let's not jump that far,
Hmm.
but as you started to do your research and learn more about it and some of the challenges and the way the healthcare system works, what did you identify that you could change?
Yeah. So excellent question. When I went into this, all I had were questions, right? Why does this technology exist, but people can't access it? Why don't insurance companies cover a test that could essentially not only save lives, but save them money, right? If you can
Hmm,
prevent a problem from happening, why wouldn't you want to do that, right? Save your money.
sure.
Healthcare problems are expensive. Why aren't doctors being more aggressive and prescribing this? What are the various types of genetic tests that are out there? Is there only one test? Are there 100 tests? Could we make this cheaper? Is cost a problem? I had an endless amount of questions. And what I learned was that every question that became somewhat answered opened up a whole new can of worms of other questions to be answered, right?
Mm.
I think ultimately what I had to kind of come to terms with is that there really isn't an answer to everything. And if anything, you have to sort of come up with the answers yourself. We interviewed throughout the last decade, myself individually and my team that I ultimately built, in growing the company, interviewed and spoke to hundreds of people. Anyone that would like pay attention to us and answer our questions, anyone from the laboratory directors to Medicare and CMS to private payers to doctors to patients to anyone that had anything to do with healthcare or genetic testing, we sat down with them and asked them these questions. And, we realized that no one had the answers. And so we had to do our best to collect all of this data and all this information and begin to make sense of it. We were the ones that had to kind of build the picture and start to answer some of these questions ourselves based on the data and the facts that we were collecting because nobody had the answers. And I think that's probably very common in the entrepreneurial space. Nobody has done what you're doing before. Nobody has asked these questions. Nobody has looked in the areas that you've looked. And the solution is going to fall on your shoulders. Answering these questions is really going to fall on your shoulders.
Yeah.
And we're still answering questions.
Sure.
So it never ends.
Okay, so walk us through how the business works from a customer or patient standpoint. What are you providing that is enlightening your customers?
Sure. So obviously, Panacea in the last decade has gone through so many iterations, so many changes, so many pivots. Our mission has always been the same, though. Our mission is to make life-changing, potentially life-saving medical genetic testing far more accessible and affordable to the public. Today, genetic testing exists in healthcare, and it is used in very rare cases, and usually when people are extremely sick. They already have cancer. They have a complex problem that nobody can identify. It's kind of used as a last resort type of a diagnostic test. But the real power of genetic testing resides in the fact that it could be used as a very powerful preventative tool, right? It can be used to identify where problems may arise if if you have the genetic predisposition for these problems, and it can allow you to get ahead of these problems. It is such a powerful tool. And so that's not how it's used in healthcare today. And we essentially decided to take this tool and kind of see it through a different lens and bring this test to more people through the more powerful preventative lens. So today, if you were to go to your doctor, you're perfectly healthy, and you say, listen, doc, I want to get a genetic test. There's some cancer in my family history, nothing startling, but some cancer, my mom's side, my dad's side. Nothing wrong with me. I'm healthy, but I'm interested in getting this test. 9 times out of 10, your doctor's going to say either your insurance is not going to cover it, you just don't fit the guidelines, right? You don't have a heavy background of cancer. They're not going to pay for it. Don't get it. Don't worry about it. Or it's not going to tell you much. Don't waste your time. Don't waste your money. Or they're going to say, go ahead and do it, but I'm not going to order. And I can refer you to a genetic counselor and kind of like be on your merry way. So the initial step, which is going to your doctor and kind of talking about this test, is kind of a very it's not a very encouraging experience. But let's say you get past that and your doctor's super encouraging. You still have to go sit with a genetic counselor and talk with a genetic counselor, probably not going to be covered by your insurance. You still have to figure out what kind of testing is going to be right for you, what kind of genetic test is going to be right for you. You're going to have to go get blood work done, most likely. It is a long, arduous process, and all the providers are disparate. The doctor's separate than the genetic counselor, and it's separate than this, and it's separate than the lab. It is a painful experience. So what we decided to do is overcome all of these barriers for people. So we partner directly with laboratories, CLIA, CAP certified clinical laboratories, and we partner directly with experienced physicians who can order this type of testing, who understand what to do. And we partner with genetic counselors directly so that the genetic counselors can sit down with people and interpret their results and guide them on the next steps and kind of really inform them on what their genetics are really telling them. And we do that in one very streamlined, simple online experience. You can essentially come to our site within seconds, purchase a test with any credit card or HSA or FSA. We accept that as well if you have that with your insurance, and access a life-saving genetic test within minutes. And this simple experience would take you potentially months in today's healthcare if you're able to access it at all. And so that's really our focus here, is to bring a phenomenal solution that exists in healthcare, but is just completely inaccessible and a lot of times unaffordable. Because of our special partnerships, we're able to really drag down that price too of this typically expensive type of testing. And that's kind of our aim, is to just have these very smart business partnerships and solutions so that we can make this test more accessible for people.
Sure. Well, Dahlia, that just sounds like something, well, from a regular consumer, that's frustrating, right? Because why should it be so difficult? But good for you for working and fighting for a solution. And so I'm curious, now that you're this far into the business, and I'm sure there's been a ton of hurdles and a ton of doors closed in your face and things like that. Where are you now in terms of, are you seeing a good number of people, or do you feel like the business has gotten stabilized and people know what you provide? Are there many others doing what you're doing?
Yeah. So no, to answer your last question first, there are really not a lot of people that are bringing a comprehensive solution to people the way Panacea is bringing the solution. We're not just providing a test. We're not just another lab. In fact, we're not a lab at all. We're not a doctor. We're not a genetic counselor. We are an aggregator of these very disparate, hard to bring together pieces. And by doing that, we're really changing the experience completely. And again, this is something that has gone through so many iterations, right? We tried something, that didn't stick in the beginning, and we tried a different go-to-market strategy that didn't stick, and then we transitioned that, and then we amplified the product, and then we worked with different labs. I mean, there were so many iterations that this business has gone through, and it really did take a decade. It really, truly did take a decade, and so much of that decade was research. Uncovering answers to so many of these questions that we had, and failing. Oh my God, so many failures, right? It has just been in the last 2 years that we've been able to identify a business model and a solution that really seems to be sticking. We initially launched in Florida about 24 months ago only. And we really ironed out some of the very early kinks. And just recently, in the last year, we've been able to expand our offering to 49 of 50 states.
Wow.
So if you are living in any state in the country, except New York, I'm so sorry, New York. New York State's very difficult to deal with when it comes to laboratory testing. You're able to access our testing on our website, and all of our providers and our genetic counselors can offer you support as well. So still, believe it or not, and we're still growing and we're still making changes, but we're kind of reaching a point where we've sort of figured out the formula, right? This seems to be working, what we're doing, and we're expanding on it. Every single quarter we're expanding offerings, and we're working with new partners, and we're getting incoming requests from physicians all over the country to use our product and to offer it to their patients. So we're, like I said, it took 10 years to get us here, and we're just now, greasing that wheel.
That's amazing. So you're starting to get to over the mountain top. What do you see for the future of the business? Are you continuing to fight into this direction, or are you thinking about pivoting to additional services, or is this the main focus?
Yeah. So what's interesting is things come to you that you never even thought about, right? Once you launch a business, the stuff you learn is stuff that you could never even anticipate. Something very interesting that's been happening is our users are coming to us. They're getting testing for themselves. They're buying testing for their partners, their adult children, their relatives. And once they get the results and they sit down with the counselors, no matter what the results are, they have a mutation that puts them more at risk, or they have absolutely no mutations. The very next question we get asked is, well, what's next? What other incredible products and services do you know about that you can tell us that will help us with our health and with our preventative health journeys? People are insatiably thirsty for these incredible technologies that exist that are not very widely accessible in healthcare, and they're coming to us and they're asking us for these things. And so in the last quarter, we've been so fortunate. We've been able to reach out to some of the most incredible direct-to-consumer healthcare companies, like Prenuvo, which is preventative MRI screenings, and of course, Grail testing, which is identifying active cancers through blood testing. Really, really incredible technologies and services that are trying to essentially do what Panacea is doing, which is to bring inaccessible but existing tech directly to people. And we're sort of, realizing that we're all on the same page, and we're building partnerships so that we can start bringing some of these products and services to people exactly the way we've been doing for genetic testing, and hopefully becoming a very robust offering for people so that people can get more in control of their health and have access to these life-changing technologies through a few simple clicks right on our site.
That's amazing. So in closing, you have, we don't need to guess if you have any grit and determination, because that's clear. So how about some words of wisdom you may give to some other business owners kind of running into some hurdles or facing some roadblocks in their business?
Yeah, I never thought I'd say this, because I think ultimately I've been thought of myself as a perfectionist for a long time. But to be honest with you, the best teacher in the last 10 years has been failure. And so my I think best piece of advice for anyone who wants to go down this treacherous entrepreneurial journey is don't quit, but more importantly, embrace failure, because it is such a good teacher, such a powerful teacher. We've learned more from our failures than any of our successes combined. Yeah. And so get ready to fail, get excited to fail. Don't let that deter you, and just keep going. Just keep going. Ultimately, the people who make it are the ones who just keep going.
So true, and really, really amazing stuff. Dahlia Attia-King with Panacea. What a story. And I'm really excited to be able to expose this just a little bit more. And I'll certainly be checking it out, because we all have to take care of ourselves on our healthcare journey. So thank you so much for your time, and please keep breaking through so we can all get healthier.
Thank you. Thank you so much. I really appreciate the time and the opportunity to talk about Panacea with you.
Our pleasure.